And we're going to be talking to the good doctor. Yeah, and she has a smile on her face. Her name is Dr. Philippa Asamoah Larbi. She's a dentist with the University of Ghana Medical Center. She's here to help us on oral health today. On health and wellness, we're going oral. Good morning, Doc.
Good morning, Jerry. How are you?
I'm good. And smiling, right?
Yes.
Yeah, I mean, is it something that is taught at dentistry school or dental, whatever, that you must always smile?
Oh, no.
Yours is natural.
Yes, it's natural. I like smiling.
Okay, I got her to smile. So, first of all, why is this a big deal? I mean, sometimes I think it's much ado over nothing. I mean, why is smiling a big deal? Why do you think we need to cultivate a beautiful smile before we go into the big questions?
Okay, so good morning once again to you and to your lovely listeners. I'm Dr. Larbi, as you mentioned earlier. I'm with the University of Ghana Medical Center and a member of the Ghana Dental Association as well.
Okay.
So why is smile important? The mouth is a gateway to the body.
Okay.
It's the first thing that anything that goes into your body sees or feels. So it's important that the entrance of the body is kept clean, right?
Okay.
Yes. I mean, if you're going to someone's house, they
The
make sure
noise.
that the hall is very clean. You'll be shocked to find out that the rooms are not in the best shape, but the hall is kept in a very good shape so that you feel comfortable when you feel at home.
Interesting.
Yes.
So let's talk oral health now.
Of course.
What is oral health and why is it essential for overall health and well-being?
Yes. So I'll start with what health is.
Okay.
Let's take it from there.
Mm-hmm.
So according to the World Health Organization, define health as the complete sense of well-being, physical, emotional, mental,
Mm-hmm.
and not just the absence of disease.
Okay.
That's the main umbrella. So if you are happy, you are in a good mood, your quality of life is improved in a way.
Okay.
Yes. So let's narrow it down to oral health. So oral health has to do with the health of the gums, the mouth, and the teeth. Because if your oral health is poor, there's pain, there's infection, you have bad breath, it will affect your self-esteem.
Okay.
Get it? And that will affect your health in general. If you have good oral health, your teeth are nice, see how I'm smiling. Get it? Yes. If you have good oral health, you are able to relate well with people.
Okay.
You have a good general sense of well-being. So yes, so oral health is a big deal.
Does poor oral hygiene affect other aspects of health?
Yes, it does. does.
Which and how?
Okay. So with systemic conditions like cardiovascular disease or stroke, if you have diabetes, these diseases affect your health and it has implications on your oral hygiene. Patients or individuals with diabetes, they have uncontrolled blood sugar levels. They have problems with their gums. Their gums are usually inflamed. They have pain and everything like that. So that also affects your oral
Okay,
health.
so it's the cardiovascular and diabetes that is affecting the oral. But has it been proven that poor oral can cause other health challenges in any other part of the body?
Yes, it's let me say it's a multi-directional relationship they have.
Okay.
It's a multi-directional relationship. And as I've already stated earlier about health, what health is, they affect each other. You get it? So if an individual has cardiovascular diseases, the person is not eating well, the person is not even in the right sense of mind to take care of his or her oral hygiene. If you have diabetes, your gums are inflamed, you are not eating well, uncontrolled blood sugar levels also implicates.
Okay. So it's back and forth.
Yes, it's back and forth. It's multi-directional.
So for you as a dentist, with years of practice, what would you say are the most common oral health issues people face in Ghana?
Okay, the most prevalent oral health issues include dental caries to decay, commonly called hole in teeth.
Okay.
Or in our local dialect, we say kaka.
Okay, yeah.
Yes.
Yeah.
So So then you have gum diseases, gingivitis, periodontitis. So what gum diseases actually are, let me just break it down in lay terms so everybody understands.
Mm-hmm.
In your mouth, you have your teeth.
Mm-hmm.
Then you have your gums, the pink stuff that holds the teeth. Those are the supporting structures. So what holds your teeth are the gums and the bone.
Okay.
So if you have gum diseases, it means your gums are affected. The supporting structures, the gum and the bone, they are affected. So if it's affected, it has an implication on your teeth. The teeth can become mobile, and then with time you lose them. So whenever I mention gingivitis or periodontitis, they are examples of gum diseases, just to be clear.
Okay.
Yeah.
Interesting. What causes these diseases?
Okay. The main culprits are bacteria. Bacteria, they're normal flora in the mouth. Okay. So bacteria, they are not bad per se. They break down what you give to them.
Okay.
They live in the mouth. You cannot drive them away. When you eat, they help in the breakdown of food substances. So when you take in food that is very high in sugars,
Okay.
taking a lot of fizzy drinks, carcinogenic diets, they break them down, and then the acids that they produce makes the enamel. The enamel is the hard part of the tooth that we see when I smile.
Okay.
The white part, the enamel. Okay, so the acids that they produce break down the enamel and then creates the cavities.
Okay.
You get it? So that's what they do, the acids they produce. If you eat a lot of diets, as I said, in sugars, they break down, and then the byproducts, the acids, break down the enamel and creates cavities. So once the cavities are created, it's like you are creating a home for them. That's more conducive.
Okay.
And they are able to stay there and create more damage. They hide between the teeth, the gums, and then they create more damage, making the oral environment conducive for them to thrive.
Interesting.
Yes.
So how often do you think one should visit the dentist for regular checkups? Realistically, in Ghana. We're talking Ghana. I mean, realistically.
Yes, we're talking Ghana.
Yes.
Oh my goodness. I get this question a lot in the clinic when patients come. Like, how often should I come?
I would ask. I'm asking.
Yes. So we advise our patients to come at least every 6 months. That's realistic, right?
Yeah, I think so. I think that is realistic.
Very realistic. So you just come for routine.
Nothing should happen to you before you come.
Exactly.
Just, you know.
Exactly. But the thing about dental patients is pain brings them. They never come on their own. Pain brings them.
The guy brushes his teeth every day, so
and
every 6 months he gets up and says, "I'm going to see a dentist," and go and spend money. Yeah.
Every 6 months, we advise that you come for a professional dental checkup.
Every 6 months.
Every 6 months.
Okay, so before I come every 6 months, what are the best practices for maintaining good oral hygiene in my house at home?
That's the most inexpensive way,
Yeah,
to take care of
at home.
Yes. So you have to brush regularly,
okay,
at least twice a day.
That thing, is it not the toothpaste salespeople who made it twice a day? I mean,
no, it's healthy for you. Trust me. People go the extra mile to even brush more than twice. Yes.
Morning, afternoon, evening.
Yeah. Yes. So you have to brush at least twice a day with a medium bristle toothbrush. The reason we say medium bristle toothbrush is because we don't want you to use a hard bristle toothbrush like the smokers that our great grandmothers and grandfathers used to use, with the notion that the harder the bristles are, the more efficient your brushing technique is, or the more efficient you are brushing.
Okay.
It's not about how hard the bristles are, it's about how efficiently you are brushing. So there's a technique to brush. You don't just
here we go.
Yes.
There's a technique to brushing of teeth.
Yes, but we'll delve into that subsequently. So you have to brush with a medium bristle toothbrush and a fluoridated toothpaste. There's a reason we say fluoridated, because the fluoride strengthens the teeth and then it helps fight against the bacteria.
I thought they said if you swallow it, it's poisonous rather.
I mean, you're not smearing the whole toothpaste on the toothbrush. Just a peanut size toothpaste.
No, it doesn't feel like you're pasting.
No, it's not about the quantity.
It must foam in your
It
mouth.
must foam. No.
It mustn't.
It's not about the quantity.
Okay.
So you're using that, and then you're using a mouthwash.
Oh,
the
wow.
Mouthwash also kills the bacteria, and then you're flossing.
What's flossing?
It's okay. So a floss, it's a thread-like material. Whenever if you go to any big supermarket, you should get some. It's a thread-like material that you put between your teeth, the interdental spaces. So the reason you are doing that is because the bristles of the brush won't efficiently get between the spaces of the teeth.
Okay.
You know, I mentioned early on that there's a technique to brush. Fortunately or unfortunately, not everyone is privy to that technique. So with the flossing, you are able to engage between the teeth and then the gums to efficiently take out the bacteria or the plaque that is forming between the teeth.
Who taught the technique when I didn't go for classes? When did I miss that lecture on technique?
I don't think that is taught in our basics.
Oh, it wasn't taught.
Yeah.
So then, how am I supposed to know? Since Dr. Philippa says there's a technique.
So you can go on YouTube. There's a technique called a modified bars technique. So with that, there's an angle with which you place the bristles along the teeth, and then there are motions that you add also, circular motions for the posterior teeth, and then up-down motions when you put your teeth together like this. So up-down motions for the anterior teeth, and then for the posterior, circular motions. You can realize that when you do that, the bristles engage the interdental spaces. And then when you open on the occlusal, like the chewing surfaces, you do your scrubbing motion. You know, so I don't want to go so much into that. But it should take you about 2 minutes for an efficient toothbrushing period. It should take you about 2 minutes. That's not too bad, is it?
No, it's not. You heard it from the good doctor. It should take you about 2 minutes. So those of you brushing for 30 seconds, you are not doing it well. And if your technique is also not good, doc said go watch the videos and learn about angles and motions and all that. Because for some of you, you just brush like you want to kill somebody. I mean, somebody said you're brushing and then I thought you were scrubbing your bathhouse. Don't do that. Doc said you shouldn't. Don't brush as if you're scrubbing your bathhouse. I'm like that. I'm like that on some Tuesday mornings. Lifestyle habits. This is the Lifestyle, Leisure and Business Radio in Ghana. The only lifestyle, leisure and business radio in Ghana. So we ask a lot of lifestyle questions. How do lifestyle habits impact oral health?
Thank you for this question. So when you talk lifestyle, I'm thinking about the individual upbringing.
Yeah.
And then, most importantly, where we find ourselves now in Ghana, where culture affects our lifestyle one way or the other. So with lifestyle, people generally do not like brushing their teeth. They feel like, okay, if I brush my teeth once a day, I'm good to go. Probably because of how they were brought up.
Okay.
Yes, your diet also affects your oral health. What you are eating, you are taking a lot of fizzy drinks, you are taking diets that are high in sugars. And as I said earlier on, sugar, the bacteria in the mouth, those that cause distraction of the two structures, they like the sugars a lot. So your diet, what you take in, you should take in balanced diet. You should drink a lot of water, and that helps your oral hygiene.
A lot of water.
Yes, a lot of water.
It helps.
Yeah, it helps. Sometimes it helps with bad breath. Some people generally have dry mouth. They don't produce a lot of saliva. And as I said earlier, in the mouth, the oral flora, they live in the mouth, they live in saliva. So once you drink water, you are creating a conducive environment, the good ones, to also try and fight against the bad ones. So you drink a lot of water, and then that helps in your breath. After eating, you drink a lot of water because it also cleanses the mouth. If you have any food particles stuck between your teeth, once you drink water, it helps flush it away from your mouth. Because once food particles get stuck there and they are broken down by the bacteria, they produce foul smelling stimulants, and that can give you bad breath. So drinking water also helps.
what about smoking? What is it with? But oral health and smoking, they don't even meet. I mean,
Yes, yes.
what is the thing about smoking? Can you not smoke and use a good paste and brush to solve your problems?
No, smoking is a very big concern within the oral space because not only does it stain your teeth, it impairs healing as well. The nicotine in the smoke impairs healing. So let me delve into the stains. So there are different types of stains. When you see people's teeth, some of them they complain, "Oh, my teeth look yellowish."
Yeah.
Sometimes the stains are intrinsic in the sense that it's within the tooth, and then sometimes it's extrinsic stains adhere to the surfaces of the teeth.
Okay.
So smoking creates extrinsic stains on the teeth, and these stains are very difficult to take away, especially with the brushing. The brushing will not take the nicotine stains away.
So what about your partners, the toothpaste makers, who say there is smoker's toothpaste and smoker's toothbrush and all that? It's just marketing.
In the past, that was what they were marketing. That was what they were advertising.
Yeah.
Because it's very hard. It gives you the idea that you're actually scrubbing it away. But as I said earlier on, it recedes the gum. It's sort of, you're scrubbing the gum away. And we remember that we need the gum because the gum is a supporting structure of the tooth.
Okay.
So once you're doing that, you think you're actually taking the nicotine stains away, but you're actually doing more harm than good because you are sort of like eroding your teeth and then you are eroding your gums, and subsequently you lose your teeth. So aside that, it also impairs healing. For especially with patients who come for tooth extraction, we take out their tooth. Especially for the smokers, we tell them not to smoke because it impairs healing. And then once you are smoking also, you can bleed post-extraction, after the extraction. So with smokers, their oral hygiene, they should really be keen about it.
And talking of oral hygiene and smoking, is it true that if you smoke, your breath is gone? I mean, you can't use any... no matter the beverage you drink after smoking, no matter the sweet you put in your mouth, nothing will help you out because your breath is always going to have that smoky.
Yes, because as I said, the nicotine it affects the gum, it affects your tongue as well. I forgot to mention the tongue is also one structure in the mouth that most often than not we forget to brush.
Okay.
Yes, but then it has a large surface area where the bacteria they can lodge in there and create certain toxins or certain foul smelling agents that can linger for a long time, and no amount of mouth rinses or brushing techniques can take it away.
Early signs of gum disease and how can they be detected and treated?
So gum disease, it starts for gum disease, the thing about it is that it can take you by surprise.
Okay.
The reason I'm saying that is you notice yellowish depositions along your teeth. We call them calculus or plaque. It doesn't start with pain. So you notice, okay, maybe I have some deposits along my teeth. When I brush, it doesn't go. I'm fine. But when I brush, I bleed.
Okay.
And then I use mouthwash and then it goes. So
that's early signs.
Early signs. But patients do not come a lot at that stage. They don't even see it as a problem. When they come, they just say, "Oh, I want to clean my teeth, or I want to whiten my teeth." They don't see it as a problem. But that's how it starts. Because once the plaque builds up, plaque is the thin film we see along our teeth, especially when we wake up in the morning. So after eating, you can notice a thin film along the lines of the gum. Okay, so once it prolongs, then it hardens and becomes calculus.
Okay.
This causes inflammation of the gums for a period of time. So as I said, it will start with bleeding. You brush, then you bleed. Then it transcends into pain. Then it can cause an infection in the long run. So the early signs are the bleeding on brushing, the pain, and then in most advanced cases, it can cause loss of teeth. You actually lose your teeth.
modern treatments that are available for tooth decay or damaged teeth. What are people doing now to handle the holes you spoke about and all that?
Okay, so this brings my mind to a situation I was faced with
Okay.
recently, or I've noticed within the short years of my practice, is that people do not see issues with their oral health as a problem.
Yeah, because you're not gonna die. So if you're not gonna die, I mean, this is Ghana.
Yes.
You're not gonna die.
Because if
you know.
someone has a cavity, the hole in the tooth, and there's pain, they take pain medication and then it goes down. They think they are healed or the sickness is gone in a way. But what they fail to know, what they fail to see is that the cavity there is the problem.
Okay.
No amount of mouthwash, no amount of painkiller can close up that cavity. Do you get it?
Yeah.
Yes. So you need to, if you have a cavity, you don't need to be at home, because when you come, we have modern treatment options like fillings. We have root canal therapy. And I mean, before we decide whether we are going to just do a filling or we are going to do a root canal or we're going to do a crown, we examine you to see the depth of the cavity, how big the cavity is, the damage that has been done. Then after clinical assessments and we take x-rays, then we are able to say, okay, you need a filling, or maybe the tooth is broken down so badly we can't save it, we have to extract it. Then we have other options of tooth replacements like dentures, what are
Great grandfathers used.
exactly they wear and then they remove it. And then we have implants, and then we have crowns and bridges. Those are more fixed options to keep your teeth. So it also depends on what you want and what you can afford.
Interesting. How effective are cosmetic dentistry options? Because you've mentioned some. I want to know. I mean,
Yeah.
that was the guy name? Shatabando.
Yeah.
Yeah, Shatabando is like the poster boy for dentistry these days.
I saw
Shatabando
that,
worked
I
on
saw
his.
that.
Yeah, I've also seen that video on social media.
He looked great.
Yeah, he looked good. He looked good. I mean, so yes, Shatabando is now your this. Is it big? Is your poster boy in your industry now? You both should plaster him on billboards all around. You know, is cosmetic dentistry on the rise?
Yes.
It is.
Yes.
I suspected
is.
so.
It really is. It really, really is. It didn't used to be so when I was a student, but then it has just risen within the.
But not
space
all dentists do cosmetic dentistry.
Yeah, not all dentists, but we are actually taught.
Oh, okay.
So if you are in a practice and you can do it, or you have the equipment and resources to do that, then you do that.
Okay.
Yes, it's very effective cosmetic because it enhances your appearance. So it includes veneers, teeth whitening, and then if you don't have teeth at all, you can do an implant, as I said earlier on. But the thing that we should know is that although you are concerned about aesthetics, your appearance, it has to be healthy. Your teeth have to be healthy. It's like being dirty and then not bathing and wearing clean clothes.
Yeah, you're still messed up.
You're still messed up.
It's true.
It? And so in as much as it's going to enhance your appearance and make your teeth look whiter, your smile brighter, more confident when you're talking to people, you have to improve your oral hygiene first. And we spoke about that earlier on by brushing twice daily, because what's the point in whitening your teeth when you still have poor oral hygiene?
Yeah, you come back.
You are not eating well, you are not drinking water. You come back, you spend so much money to improve that, and then in the end you go back.
It's true.
Get it. So I mean, it's very efficient in improving your appearance and how.
But don't you get a sense that people are using it as a cover up for their poor oral hygiene practices? Like you won't look after your oral hygiene well enough, because eventually you make money and go and do a shatabando.
Why are you bringing that up?
All right,
yeah,
so
there'll definitely be people who will not see the need, see the need to do what is of most importance before they move to the whitening. I mean, if the market is there and you can afford it and you understand the dynamics of it, then you can go for it. But I always advise my patients that I do whitening for. I let you know the whitening is not bad. If it's done well, it's not bad. So I let you know that, okay, we will do this for you, but you have to maintain a good oral hygiene, because there's no point in doing what you want to do and then you come back again you come back worse than you came initially.
Yeah.
That's it. Yeah.
It's close. It's a 9:30, meaning we just have about 25 minutes to wrap up this conversation, and it's getting quite interesting. Let me find out from the good doctor. Do we all naturally have to have pearly whites? Naturally, if the guy looked after himself or the lady looked after himself orally well enough, do we all have pearly white teeth?
No, we all can't have pearly white. I don't even have pearly white teeth.
Yeah. So I mean, what is this thing about whitening? If my natural teeth color is not supposed to be white, why are you whitening it?
Okay. So let me start from the basics to make us understand why we all can't have pearly white teeth. So the shade or the color of your teeth is linked to genetics as well. Your family.
Okay.
So there are some, when you enter into a particular family, some of them, they naturally do not have white teeth.
Yeah.
They have yellow.
It doesn't
teeth.
mean they are terrible in oral hygiene.
Yes.
Yeah.
There is genetics.
Okay.
And people also have white teeth. No matter what they do, they have white teeth.
Okay.
So that's the first thing. And the second thing is, people have the notion that, when I was little, my teeth were very white. So I don't know why now that I'm older, I have yellow teeth. So the thing about that is, when you are little, your teeth that first come into your baby teeth or the milk teeth are whiter because of the opacity. Okay, let me not use it. Because of how thick the enamel is. So the teeth has 3 layers: the enamel, the dentine, and then the pulp. So the enamel is what we see. When I smile, that's what we see. That's the hard parts that we see. And then underneath it, we have the dentine, and then we have the pulp. So the pulp has the blood vessels and the nerves. And then the dentine has just the nerves, and the enamel doesn't have anything at all.
Okay.
Yes. So children have thicker enamels, so they don't reflect the dentine. The dentine is naturally yellow. Everyone's dentine is yellow.
Oh, okay.
Nobody has white dentine. It's naturally yellow. So once something is very thick, of course, it
covers
exactly.
Yeah.
So you don't see the dentine. But
as you grow older,
we are eating a lot of things. I mean, adults, once you have your adult teeth, the enamel is not even as thick as the baby teeth by virtue of being an adult. Yes, but as you age, you are eating a lot, you are drinking a lot, you are brushing hard with smokers.
Yeah, with smokers toothbrush.
So it erodes the enamel to an extent, and then with time it reflects the dentine.
Which is yellow, which is the second layer.
Yes. So naturally, I mean, your color will transcend to an extent. Aside that, then you have, there's a normal range of teeth color. If you ask me, I'll not mention my age, but if someone who is 6 or someone who is 7 has my teeth color, I won't be very concerned as compared to someone who is 3 and has my teeth color.
Okay.
Because
I mean, it's too early.
It's too early to have that. Maybe then we have to investigate.
Exactly.
So your family, did they naturally have yellow teeth, or were you sick that you took some medication? Because some medications also, when taken at an early age, can affect your teeth development. So we investigate that. Once we clear all of that, then at least we move on to more investigation, like what is causing.
Yes. Why this particular?
So this is the foundation that I've laid. So then whitening, get it. So whitening is bleaching your teeth naturally. When we say whitening, means you are bleaching your teeth.
When you bleach it, do you erode a bit of the surface as well?
Yes, and you are depositing chemicals that turn the color whiter in a way. Yeah, like you are not making it reflect the dentine more.
Okay.
But you are eroding the enamel in a way. So it will make the teeth quite sensitive, but then it goes back to normal with time. So it's not advisable that like you do it.
Yeah, I was going to ask that, does the is whitening like forever, or does it reverse after some years?
It will, because you eat certain things that will stain. Of course, we give you instructions like after the session, do not take this, do not take this, reduce it if you take it a lot. Yes, of course, it won't stay the same, but it will not go back to how it used to be. It may or may not, but depends on how you also manage your oral hygiene. Yes.
Interesting. Since you brought the issue of the child, at what age should parents start focusing on their children's oral health?
What do you think? Let me throw it back to you. What do you think?
I think since you want good habits to stay as early as possible, right? Yeah,
yes, that's true.
Yeah, so that they learn. So maybe you should go and watch the YouTube video doc Philippa is talking about. Learn the techniques, the angles and the motions, and go and teach the child, so that train up the child in the way he should go, so that when he grows,
Exactly.
yeah.
So
I mean, for me, I think as early as possible. But
yeah, I agree. Immediately you notice the teeth coming out in the baby, erupting in the baby's mouth, you have to make them see a dentist. You get it? Because not only does it help you, the parents, it instills good behavior in you and the child as he or she grows.
Okay.
You get it? Like maybe, of course, as the baby, he or she may not know, but if it becomes routine, and then as the baby grows and becomes more self-aware, that okay, maybe every 6 months we go and see the dentist, it becomes a routine for them, and then it actually instills good behavior, dental seeking behavior.
Wow.
Yeah.
You see, this thing about brushing twice, it sounds white man like. I mean, westernized. You know, the kid is going to sleep, and then the kid said, "Have you brushed your teeth before?" Charlie, this is Ghana, man.
No, it shouldn't be an excuse. I don't think it should.
I mean, you know, it should. Anyway, in most cases, what I've noticed is it's more like depending on what is eaten before that evening.
No, and no.
Ah, come on.
No. When you wake up, you are supposed to brush your teeth. Some people eat, then they brush.
Okay. Yeah, that's a good point. Let's handle that very issue. When you wake up in the morning, should you eat before brushing or brush before eating? Yeah, we put in a doc on the spot. We're putting a doctor on the spot.
You should brush before you eat in the morning.
Why? Are we not told that, if you wake up, you should even drink water, and that the bacteria in the mouth, when you drink the water, and it is medicinal also? I mean, debunk some of these things for us.
So personally, I mean, other dentists may have a different opinion.
Yeah, it happens in your medical field.
Yes.
You know, people always have their ideas.
Yes. But personally, I would brush immediately I wake up, because I want to remove whatever I had. Of course, I brushed the previous night. But assuming I didn't brush the previous night.
You see why one of those brushes is a waste of paste?
No, it's
one is a waste because you brushed and went to sleep. You woke up and you're brushing again. What happened when you were sleeping?
So let's just assume you brushed before you slept. You are asleep. You close your mouth. No air.
Yeah.
No saliva. As I started early on that. Once there's decreased saliva production, the bacteria, they like it.
Okay.
You get it? You are not swallowing, so the bacteria are there. They are creating more damage. They have multiplied between the time that you were asleep. Do you get it? Yes. So you wake up. Why don't you want to clean your teeth before you eat? Because once you are eating, you are going to give them some time to break down and do more damage. So why don't you clean, you eat? You can decide to rinse your mouth after eating. That is if you have brushed. So I'm talking from my personal, my conviction, what I do.
Anyway.
But personally, I would brush before eating and then brush before.
Yeah, I think the normal thing is for people to.
Let's just stick to
Yeah.
routine.
I mean, for you, a dentist, you want us to brush as many times as possible. So if we brush before,
twice would do.
twice
If
we
you
do.
brush twice, I'll be happy with you.
Okay,
Yes.
okay, that's all good. What are the main oral health challenges for children, and how can they be prevented? Do you see a lot of kids being brought to your practice?
Yes. Personally, I love kids.
Okay.
I love working with them. They are very interesting.
Yeah, they just can't sit straight. That's the
They
other problem.
But you know, some of them are very compliant. You can see a child as young as 3, they can sit in the dental chair. They are not scared. What you have to do is explain to them really layman terms so that they understand what you're doing. You make it exciting for them, and you reward them for good behavior.
With a sweet.
Not with a sweet. You know, funny enough, some parents bring their kids to me, and then they are taking sweets before they come to me.
Yeah, I mean,
So whenever they come,
that's why I asked that
I'm
question.
like, you are coming to see me, and you're taking chocolate.
We're giving you extra work before we pay you.
You're showing me what you actually do.
Exactly. We want to tell you that this is what we do. I mean, sit down, let doc work on your teeth. After I'll buy you ice
No,
cream.
you don't.
After I'll give you sweets. Yeah, I've seen that. That's why I asked that question. But what are the challenges that children are facing that they are bringing to you?
Yes, thank you for the question. I'm seeing a lot of children with dental caries, the tooth decay.
Okay.
Yes, that's the most prevalent dental health issue that we get in our pediatric patients. I may digress a bit,
Please
but
do.
we have something we call early childhood caries or rampant caries. There are some children, you see them, they have black teeth, very young, it's badly broken down. You ask yourself, how did this happen? You get it? So that is early childhood caries or rampant caries. Some mothers have this habit of feeding their babies late into the night, nursing them milk, they are breastfeeding, and then they sleep with the breast in their mouth. That is not a good habit to have.
Okay.
Once the child sleeps, just take the breast out of the child's mouth. The child doesn't.
Yeah, when you move it,
sleep.
now the child will start crying.
You have to maybe put in a pacifier or something to give them the idea that they are still sucking.
And these guys are bachelors. They wouldn't know what I'm
They
talking
wouldn't
about.
know.
Yeah, so I know what I'm talking about.
Yes.
That when you remove the breast, now the baby will cry.
Yes.
So keep it in and let everybody sleep in the house. Tomorrow we are going to work.
No. So it's destructive.
Okay.
Yes, it destroys the teeth very early. And rampant caries destroys the teeth at a go. It's not
All teeth. I
all
mean,
teeth,
yeah.
all the baby teeth.
Wow.
Yes. So that's what we get a lot. And most of them parents do not know until it happens to their children.
Wow.
So we advise mothers to, at least when they sleep, do not continue to feed them. Just take the breast or the milk out of their mouth. Dental caries, yeah.
Interesting. So on a whole, as Ghanaians, what are the main oral health challenges we face as a people?
Lack of dental awareness.
Hey, they're visiting 6 months later. It's like we must come.
Yes, lack of dental. And then I appreciate this space as well to engage the people, to let them know. It will surprise you that although we are in the 21st century, people still think when you have dental caries or tooth decay, it's a sickness that you treat with medication. But it is not so. We should have this cordial relationship with people. Dentists, however, people associate pain with dentists, unfortunately.
You see, so Doc, no matter what you say from this part of the interview till we are done, this is why I wouldn't agree with you. My roommate went to take teeth out or whatever because they said something is broken somewhere, something is not growing up, is growing somewhere that is pushing some other teeth and all. Bottom line, she goes to take it out. She takes it out on a Thursday or so. That Sunday dawn, I was firing 120 kilometers or miles per hour, whatever, to the nearest hospital to get her sorted out because she couldn't sleep. She was rolling on the ground, disturbing everybody. How is a dentist not related to pain? When just a month ago, I saw one in my house rolling on the ground crying.
Okay. I appreciate your experience.
Yeah, I'm just telling you what happened
There's
in my
also
house.
someone who loves dentists. Oh my goodness. Dentists bring me peace. I was in so much pain. I saw the dentist and oh my God, he saved my life.
Yeah,
So you
right.
see, it's subjective. It's subjective, you know, and then it's also case dependent because whatever we do, we give instructions. So it could be that maybe she didn't
Yeah,
adhere
so
to
so so the thing is that a natural part of this thing? Because I saw the X-ray, and it's true. Rather, teeth going this way, teeth rather going as if it's pushing the other way. Yeah. So sometimes it's nature, right?
Yeah.
Because this one is not bad oral health. It's just the way the teeth
No.
grow.
Yes, that we had to take it out surgically.
Yeah.
But because it's a bit, I won't say it's a traumatic extraction, but it's more, it's not just a simple extraction. You have to do extra. And afterwards, we give you instructions that you have to adhere to. We are very strict on that. Because if you do not adhere to it, then you come back to us with pain and then you say, we have given you
Now,
pain.
you people cause pain.
No.
I mean, when I was growing up, the statement of you have to go and remove your teeth.
Scary.
It was scary to everybody in my neighborhood. I mean, and then you see people remove their teeth and then they are holding their mouth and they are coming out that, oh my God, for the next 1 week, everybody's in trouble. They can't do certain. So, you cannot blame us. You cannot blame us. Now, let's move on from there. Let's move on from there and talk about the cultural practices of oral hygiene then and now. Is there any proof that what we're doing now is working as opposed to the sponge and the stick that we used in the past?
Okay. I was having this a similar conversation with a friend yesterday.
Oh, wow.
And then in discussing it, we realized that 20, 50 years ago, the diet that we were used to is not the diet that we are having now.
Okay, that's a good point.
That's the first point. I mean, in the 18th century, there were a lot of greens. There was no such thing as Coke.
No.
Plantain chips.
No, check.
Chocolates. No.
Nobody was eating check.
We're eating greens.
Yeah.
Balanced diets. And remember I mentioned earlier on that balanced diet improves your oral health.
Yeah.
You are not getting a lot of broken down sugars in your mouth for the bacteria to release acids to break down your teeth.
Okay.
You are eating, and some of the fruits, for example, raw fidges, it improves gum health. It has a natural cleansing ability because as you are chewing, you're munching on the orange, it's cleansing the teeth because it's engaging the teeth, engaging the interdental spaces as well. So naturally, by virtue of what you are eating, you are cleaning your teeth. You are not going to KFC, sorry, but you are not taking in a lot of refined sugars. You are not taking in a lot of foods that are high in sugars that the bacteria can work on. So your chewing stick will help.
Okay.
You get it?
Then it would help.
Then it would help. You are drinking water. You are eating well. You are sleeping well. Sleeping early. No midnight snacking. So your oral health is good. Your chewing stick will do. But now, see what we have in the market. It's not bad. It's there. But you have to improve your lifestyle. You are getting a lot of these foods in the market that are easily accessible. So the chewing stick is not enough. You can't rely on it alone. That is how come the white man in his own knowledge has come up with other ways, mechanical ways to actually help to clean the teeth. And then also creating awareness that you have to eat well, eating balanced diet, drinking water, taking fruits, because they also have a natural way of cleaning the teeth. So then and now, culture culture had a good role to play, but now it's not sufficient for good oral health outcomes.
To be using chewing stick and all that.
You can still use it because if patients come to me or clients come to me that, oh, can I still use chewing stick? I say yes, you can, but it should not replace your toothbrushing.
Oh wow!
You can
then why are we chewing the stick? Chewing stick is supposed to replace, not.
No, it cannot replace it because, as I said,
even if you turn the stick with some angles and add a bit of fluoride to the mouth and all that.
It will surprise you. that, of course, the chewing stick has some other chemicals in there that are good. But as I said earlier on, you use the chewing stick, but you go out, you go and take Coke, you go and take all those fizzy drinks, and then it will affect your gum. And once the gums are inflamed, the chewing stick cannot bring it back.
So if you take away chewing stick, it means you're going to take away the sponge too. Yeah, because the sponge was what they used in the rural
You
areas.
can.
But they still must brush.
You still must brush. You should not replace the toothbrushing. You can do with just toothbrushing and not use the sponge. But then you should not. It cannot replace the toothbrushing.
Interesting. In the rural areas, do they have how accessible is dental services in the rural area? Because they are still using chewing stick and sponge.
Yes. I mean, if there are no other options, I mean, chewing stick, I'll still advise if you don't have the means to get that, then it's better than not cleaning your teeth at all. So yes, you can still use it, especially in the rural areas. Unfortunately, there are disparities in the provision of dental health services. Of course, the government or the government is trying to at least make sure that every district hospital has a dental care in a way.
Okay.
And then sometimes there are some outreach programs that involve the underserved regions in the country.
Okay.
So at least with that, we are trying to make sure that although there are not a lot of dental facilities in the rural areas like in the urban areas, we are trying to make sure that it reaches them. Yeah.
Interesting.
Yeah.
Someone wants to know, why is dental care often perceived as expensive, and are there affordable options available? It's a question. I'm reading it. It's not my question. I mean, I'm reading.
I get that question a lot.
Yeah.
I get that question. I'm sure it's on the minds of a lot of Ghanaians. Dental, it's a huge barrier. Aside the fact that there's lack of dental awareness, the cost is also a limitation.
Exactly.
Yes. So I mean, it's expensive because of the materials that we use. To be honest, and dentistry is evolving. What used to be 50 years ago is not what is. 50 years ago, for fillings, we're using amalgam, the silver fillings.
Yeah, I've seen those.
But now it's phasing out. We are using more technique sensitive, more durable materials, and they are expensive. That's the truth. You get it. But aside that, we have the government hospitals. They provide affordable dental services, and then the national health insurance also covers, especially for consultation and a few simple procedures like maybe cleaning to an extent. Yeah.
Okay. How many are you? How many of you are out there? Are there a lot of dentists? I mean, per population, what are the figures like?
Per population, it's not, the ratio is not
Yeah.
so great as compared to our medical counterparts. Even that is not that great, but the dentist to patient ratio is very low. They are trying to, a lot of dentists are in the system, but the growing population is still not sufficient to cater for. But we are trying.
Are you, I mean, encouraging more students to go into it and all that?
Yes, I would encourage, if your child is interested in dentistry, they should go for it. It's a very good profession.
The person would be a doctor, but would he make as much money as a surgeon?
No, I mean, dentistry dentistry is a specialty, but within dentistry there are other specialties.
Okay.
Yes, you can be a dentist, but then you specialize in taking care of kids. You can be a dentist, you specialize in plastics or jaw surgery or implants. You can be a dentist, but you specialize in replacement of teeth only, or oral pathology, diseases of the oral structures. Yes, so you can become a specialist dentist, and you earn the same as a specialist medical officer, a specialist medical person.
Interesting. Are there special days you celebrate in a year? I mean, is there national or global dentistry something?
Yes, we have the World Oral Health Day. This year, we really, I don't know if you saw.
What month of the year is that?
I think it was about 2 months or 3 months ago.
Okay.
Yeah.
And what activities did you do?
Okay, so we took over the media spaces. We were all over creating awareness, making people aware of their oral hygiene. And then we had dental forum, dental talks. We had medical dental screening in our facilities.
Oh, wow.
Free dental screening in our facilities.
Oh, okay. March.
Yeah. Yes.
It was in March.
Yes.
Interesting.
Yes, March. So, I mean, this year was a really big opportunity to create awareness. The Ghana Dental Association really did well to make sure that people know that their oral health is important.
A happy mouth is a happy body.
Yes.
Interesting. A happy mouth is a happy body. Any final words, Doc?
Okay, so I'd first say thank you for this opportunity, and to our lovely listeners for staying tuned and listening. I would say my final words are take good care of your mouth, because if you do, you are able to function. You can smile, you can eat. If you have any infection of your teeth or the structures in your mouth, it will affect you. It will affect your esteem, how you eat, how you perceive yourself. So you have to ensure that you take care of your teeth, as we mentioned earlier, brushing your teeth, flossing, using mouthwash, and regular visits to the dental.
Every 6 months.
Every 6 months. So after this program, I hope that we'll be seeing a lot more people coming to our dental clinics for routine dental checkup.
Her name is Dr. Philippa Asamoah Larbi. She is with the University of Ghana Medical Center. She said every 6 months, visit her, pay her a visit. And a happy mouth is a happy body. Take care of yourself. Maintain a healthy smile. We've been talking to a dentist today on Health and Wellness Tuesdays. It's 4 minutes to the top of the hour. Right about now, you know, definitely.